Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for taking time to join us today. We actually have quite a bit to cover, but I'll try to go through it as quickly as possible. We have another beautiful day, and I hope everyone is enjoying the day and hanging in there. We're going to start with the data. At the high level, though, I think it's important to say, and this is good news, and for the first time ever, or in the last 2 months anyway, I feel confident in saying that we have turned the corner here in Ulster County. And I don't say that lightly, and we'll talk through the data and the reasoning behind that, but I do think that is very good news. We're not through it yet, but we have absolutely turned the corner on this, and that's all thanks in large part to everyone of you that have done your part to follow the pause orders, to do social distancing, to wear masks, all the things that we've asked. So thank you, and it's a little bit of good news. We still have a lot of work ahead, but I am more optimistic than I've been in a while. So we'll talk through why that is here with the data. Starting with the graph that we usually show in terms of total cases in Ulster County, we are now at 1,474 total positive cases. And just to be clear, this is a cumulative number that doesn't take into account those that have recovered. This is just over time, the total number of positives that we've had over the last 2 months. We have now tested 7,965 residents of the county, so just shy of 8,000, and that puts us still right around 18.5% of positive cases compared to total tested. We continue to see, unfortunately, fatalities occurring. We're now at 51. This is, again, unfortunately, predictable in terms of fatalities being sort of a lagging measure of where we're at, because it often takes quite a while for folks to fight this. And again, absolutely tragic that we're now at 51. But I also believe that it would be significantly higher if not for everyone's efforts on that front. And we have now had 629 county residents recovered from COVID, which continues to grow at a much higher rate than the number of positives. In terms of the projections looking out, you can see they're about the same. We're still tracking towards that best case line, which would put us at 1,600 cases 10 days out. We're going to show you today a series of new kind of looks at the data, new graphs to help articulate why I feel comfortable saying that we have turned the corner. One of these we showed you on Tuesday, but we've added another line here. This is the hospitalizations in the county over time. So this is on any given day the number of county residents in the hospital. And you can see a very clear downward trajectory there. We are now at 11 hospitalizations. On Tuesday, we were at 12. You can also see along the bottom the daily average of numbers of deaths. So that, again, is a number that we want to and need to and will get down to zero, but we continue to work and fight in that front. But the overall hospitalization going down is very, very good news. It's also a critical measure towards our process of reopening as outlined in the framework from Governor Cuomo. The next two charts that I'm going to show are both new charts, and we are going to be updating our web page as well, our dashboard online in the next few days to provide more of these visuals for you as well in real time, but I'll start by sharing this version of them. So the chart up now is this is the number of active cases. So what this really means is if the total number is a little over 1,400 and we've had almost 600 recover, this is the differential between that. That means that right now at this moment, although we've had almost 1,500 total positive cases, there are only 788 active cases of individuals who have not yet recovered. This is one of the real big indicators where we are seeing a clear peak there on that graph, right around the last week, heading into the last week in April, was where we saw that peak in active cases, which also corresponds with the reduction in hospitalizations as well. You can see it's starting to level off a little bit, but we are pretty confident that we are ultimately on the downslope and that we have reached that peak of active cases, and we'll continue to work to bring that number down, of course. And then finally, this is a little bit of a more complex chart, but I actually think this chart really shows visually most clearly the dynamics of turning the corner and being well past a peak of the situation with COVID-19. You can see, again, right around mid-April, we had a clear peak in this statistic, and what this is each day, how many new positive cases are we getting? So each day that we're doing testing, we get some number of test results back. Generally around 20% of them are positive, but that is varied with time. And you can see at the worst, we were getting close to or over 50 new positives a day. Very consistently in the second half of April and into May, that's been cut in half. And that's all happened as we've actually been ramping up our testing. So it's very clear that even as we do more and more testing, we're seeing the number of new positives go down, and that is a very, very encouraging measure for us as well. Finally, this is a graph that you're used to seeing, but more good news here in terms of our hospital and treatment capacity. We are now at only 11 hospital beds being utilized for COVID-19 patients in the county, and only 1 ICU bed and ventilator being used. Those numbers have continued to go down. As I said, that was 12 beds on Tuesday and 2 ICU beds on Tuesday. So encouragingly, those continue to go down, and we're very good in terms, of course, of near-term and long-term need if we did need to surge additional capacity there. So many of these measures that we just talked through are also intimately linked to the reopening framework that Governor Cuomo has outlined, and so we are making good progress there in feeling from a public health perspective that we're on the trend to be in a good place to safely and responsibly reopen, and we'll talk a little bit more about that as we go on here. Before we do that, though, I do want to say it's absolutely critical that we keep ramping up our testing, both diagnostic testing and antibody testing. Again, as a reminder, diagnostic testing tests, do you have active COVID-19 in your system in your body at that moment, and antibody testing would show that you had COVID-19 in your body at any point in time and had some sort of immune response to it. So very, very big announcement today, and I want to thank Health Alliance for their support on this. Health Alliance Hospital at their Broadway campus is now offering voluntary antibody testing to first responders. Any first responder in Ulster County who thinks you may have had COVID-19 and would like an antibody test can go ahead and schedule an appointment with Health Alliance, and they will do that test for you. It's a different test than the diagnostic test, so you don't have to get a huge swab shoved up your nose, so that's good news. And they can get you set up. On the screen, you can see the phone number to call there. That is 845-303-2730, 845-303-2730. So I talked about this last week, that when we got antibody testing, we would start by prioritizing our first responders and our frontline workers. So that's what we're doing. And this is a major development for the county, that we now have this capacity. And this is also critical to us getting out of the worst of this and having a better sense of the picture on the ground. And again, I want to thank Dr. Doyle and his whole team at Health Alliance, not only for standing up our third diagnostic testing site, which is still running and still taking patients, but now this antibody testing for first responders. And then final update on testing, more good news here. we are going to have a 4th testing location in Ulster County. This one is provided by RITE. So about 2 weeks ago, Governor Cuomo authorized pharmacies in New York State to be able to do COVID-19 testing, and RITE today announced a series of testing sites across New York State, and we're fortunate that we'll have one of them here in Ulster County. You can see the details, but it's their Flatbush Avenue location in Kingston. Their testing at RITE will start on Monday, May 11th. It's completely free of charge to patients, and you can set up actually an appointment on their website, riteaid.com, as shown on the screen there. If you want to schedule for next week on Monday, they will start scheduling on Sunday, May 10th. And my understanding is that this is diagnostic testing. So this is more diagnostic testing at RITE. We are going to continue to work to get the antibody testing more broadly available. But right now, we now have 4 diagnostic testing sites, or we will on Monday, thanks to RITE, as well as our other partners, Ellenville Regional Hospital, New Vance, and of course Health Alliance, that have really stepped up to boost our testing. Making sure we have enough testing capacity is another critical condition to make sure that as we begin to plan and think about reopening, and when we eventually do, that we have that capacity to be prepared for any potential surge that may come and to detect it quickly. So the fact that in a relatively small county we've now done just shy of 8,000 tests, that's now 4.5% of our total population in the whole county. A few weeks ago, we were under 3%. So we're making really good headway here, and we're going to continue to ramp up that testing effort. So switching gears for the second half here, I'm going to talk a little bit more now about our economic resilience plan. So because of the good news that we've seen or are seeing in terms of turning the corner on the public health aspect of COVID-19 epidemic, we feel more and more confident that we will be reopening responsibly, deliberately in the coming weeks, and it's very important that we do that in the right way. And the details really, really matter, that we've thought through everything, that we're balancing public health against the need, of course, to get people back to work and to get our economy going again safely. So the 3 pillars of our resilience plan: recover, reopen, and realign. I'm just going to give you some updates on each of those. In terms of recovery, this is about getting immediate help to our residents, to the families of Ulster County, as well as to the businesses and the nonprofit organizations in Ulster County. So one of the key pieces of this is loans and capital to our small businesses and our not-for-profits. So thanks to our federal leaders, Congressman Delgado, Senators Schumer and Gillibrand, the federal second round of PPP loans, so the Paycheck Protection Program loans, those federal loans are happening and being given out through our community banks and other banks in Ulster County. The Small Business Association just put out a release this morning. There are still over $100 billion in the country eligible to be given out as loans. So there is still money available to our businesses and not-for-profits in Ulster County to a significant degree. So if you need help on that, you can always reach out to our county economic development team led by Lisa Berger, as well as our Small Business Development Center, Mr. Arnaldo Severit. They can help you. You can also always, if you need help getting directed to them or anything, you can always call our Ulster County COVID-19 hotline. That's 845-443-8888. All this information is on our ulstercountyny.gov page, but I would really encourage all the business owners out there. I know you're under tremendous pressure, not-for-profit organizations, community organizations. You are eligible for this money, and there's more money to be had, and we're here to help you recover that. Additionally, beyond the business and not-for-profit support, we also stood up 2 weeks ago a recovery task force that's focused on really the critical human services and social services that provide a safety net for our community, even pre-COVID, but it's even more important now with the pressure and strain that everybody's under. So I'm going to talk a little bit about some of the initial results from that work and some of the steps we've already taken as a county to help provide these critical services. So we know that opioid addiction and usage and overall substance abuse was already a challenge prior to COVID. We have seen that in preliminary data. We don't have official final data, but in preliminary data, that has, as we expected and sort of predicted, gone up a bit. And so we are concerned about that. We are focused on that. And I'll talk a little bit in a second about what we're doing there. We're also working on some mental health services and boosting those. We know how much strain this is putting on our residents in that regard. And housing, security, and ultimately shelter. We'll talk a little bit about that. So in terms of what we're doing on opioid prevention, I'm going to put up a slide with a lot of words on it, but at the end of the day, what we're really doing is everything we possibly can, knowing that the pressure is even greater now and the resources are harder to get to for those struggling with substance use disorders, where we've taken a series of steps. So we have actually stood up a county-wide virtual training program for Narcan. We know how critical that is to keep people alive. We're partnering with many different local community groups to do that, and we've set up pickup sites, safe pickup sites around the county for anyone who needs Narcan. So details are available on that. We've also provided funding to 2 different sources to provide immediate additional support on opioid prevention. $50,000 to Samadhi, great organization that serves Kingston and the wider area. That will help provide peer support for those in recovery through the Health Alliance emergencies, through our county jail and other entities, and then $21,000 to the family of Woodstock, which helps provide transportation for those that may need to get to opiate court or other transportation needs. And then finally, we had announced this actually last year, the federal grant to address opioid abuse, one of our big 5 priorities of tackling the opioid epidemic. That is still happening, and in the time of COVID, of course, we're focused on COVID, but we have also hired 2 full-time employees, grant funded, to make sure that we are meeting these needs in terms of opioid prevention and substance abuse disorders. So I just wanted to share a little bit of that. In terms of mental health, we know there's tremendous strain on those in our community who were previously suffering with mental health issues and may now be as well. There are many things we're doing, but one of the specific ones that we just got going about a week ago is our Generation to Generation program. I actually announced this, what feels like a very long time ago, at our State of the County address, where we talked about this very cool program where high school students are now virtually meeting with seniors in our community and engaging with them and actually ultimately capturing basically their life stories and building a living history of the people of Ulster County. So our seniors, who many of whom are homebound and under a lot of pressure, and our high school students who are experiencing all kinds of just absolute turbulence and challenges as well. We're bringing them together through this program to engage with each other and to just provide that human connection that so many of us are desperately needing and craving in these times. So that is a really cool program, and if you're interested in that, we can get you those details. And then finally, on housing security, we know, I mean, at the end of the day, food and shelter and clothing are these absolutely existential needs for everyone, and we know that so many are struggling with this. Through Project Resilience, we've done a tremendous amount of work on the food insecurity issues. We have more work to do there. But in terms of shelter and housing, 2 good news announcements. One of them from Governor Cuomo today, who in a very positive development, extended the moratorium on evictions across New York State now through August 20th. So anyone in New York State who, for whatever reason, might be under threat of eviction, whether legitimate or not, that is illegal in New York State, and there is a moratorium on it until at least August 20th. That was set to expire, and very good news, and thank you to Governor Cuomo for extending that on behalf of, I know, many people very worried about that. Going along to support that, here in Ulster County, we have stood up our tenant protection unit, really designed to be there on the ground level to meet any issues that our tenants and residents are having. We had been hearing lots of complaints about this, and I just got an update here. So we stood that up about, I think, a little over maybe 2 weeks ago now. We've already responded to over 80 problems and inquiries by phone and email from Ulster County residents that have called that tenant protection unit. Many have called with complaints of landlords that are employing tactics that are not legal and that are problematic. An anecdotal example, and I'm sorry that I'm reading here, a woman in senior housing whose landlord was asking that she sign an addendum to her lease 5 months into what was already an annual lease. Her landlord is pressuring her to sign an addendum, and she was told that she'd have to leave by June 1st if she didn't sign that lease. Our tenant protection unit was able to get in touch with her, advise her that that's absolutely not the case, that there is a moratorium on evictions, and that under the terms of her original lease, she was not at all in breach for not signing and giving in to the pressure tactics of this landlord. So again, we and I have zero tolerance for our residents, our renters and tenants being taken advantage of anytime, but especially at this time. So our tenant protection unit is available, and if we could put that graphic up one more time, just so you can see the number here, you can go to our website or you can call 845-340-3232. That is for our Ulster County Tenant Protection Unit. And I want to thank our public defenders who are, in addition to the other work they're doing, have taken on this important mission and are doing that good work. Finally, in terms of updates on our resilience economic plan, we talked about all the recover efforts. In terms of our second piece of that, our second line of effort, reopen. So we've made a lot of progress here as well. Two significant updates. Number one, in anticipation of whenever that date is that we meet the criteria to open, we know we have a lot of work and thinking to do to think through sector by sector, industry by industry, how do we safely and responsibly open? What does that look like for retail, restaurants, hospitality, manufacturing, construction, financial services, on and on and on. So in Ulster County, we have stood up 7 sector-specific working groups. They're led by county employees, but also informed by volunteers from our business community who know these industries and can work together to come up with recommendations. We will then take those recommendations. We'll both share them with our regional partners, and then we'll ultimately send them up to Governor Cuomo and his team so that the statewide plans are informed by what's happening here on the ground in Ulster County and the great thinking of our business leaders. And so to facilitate that, we mentioned this on Tuesday, but just to reiterate, we are taking a regional approach to the reopening, and actually tomorrow, myself and the leaders of 6 other counties in the Hudson Valley will be having a discussion about this, where we'll each be sharing our plans, coordinating, sharing data, and all the different best practices that we're all thinking about. And ultimately, our goal is, as everybody develops our ground-up plans, we'll agree and have some consensus, and then we'll surface them up. So the members of that work group span the Hudson Valley region, of course, Ulster County, but we have Greene and Columbia, Sullivan and Dutchess, and Orange and Putnam. So this is exactly how I think it's supposed to work. We have local governments informed by what's happening on the ground, building our recommendations. We'll share them with our regional partners so that everybody's on the same page. You don't have wildly different rules in Greene County, when you go up there or over in Dutchess or down in Putnam, whatever the case may be, we're all on the same page. And it's as this is going to be complex, but we'll try to remove as much complexity as we can as we safely reopen. So those are the updates there. I do want to emphasize, and I've heard from many of you, understandable concern that we can't rush to reopen, that we have to be very careful and deliberate. And I absolutely understand that, and I 100% agree with you. And I just want to be very clear. What we're doing right now is we're doing our homework. We're doing the thinking, the research, the planning, the coordination, so that once we feel that it is safe, both at the local level and ultimately at the state level, we're ready to go. Not just quickly, but to go in the right way, in the safe way. So that's what we're doing here. And I get that there's a natural tension and balance, and I'm comfortable that right now we're in the right place in terms of those two factors. But please keep the input coming on that. And if you have ideas related to this or thoughts, you know how to reach us, and please keep them coming. Finally, and I know we covered a lot here, rapid fire. As always, I want to end with we started with some good news in terms of turning the corner here in Ulster County, but I also want to end with some good news, which is our Project Resilience continues to chug along and maintain momentum. We are now between prepared meals and grocery meals built from groceries. We're at almost 150,000 meals delivered to residents of Ulster County, all across the county, every corner, supporting 3,400 plus households, 16 teams on the ground, hundreds of volunteers, and over 160 restaurants. And we've gotten calls from all over the state and the country saying, how did you do this? How have you been able to, one, partner with and harness the grassroots sea of goodwill that we had here of so many great community members, two, raise almost $2.5 million, and then three, tie in our small businesses so that our restaurants that are struggling to keep their doors open are able to do that and get some revenue in the door, keep people employed. So I'm really proud of what we've done with Project Resilience. As I've said, we're going to keep it going as long as we can. We're going to shift more and more to grocery delivery so that we can make the dollars that we do have so generously given last even longer. So we'll be doing that in the coming weeks, and we'll share more about that. But we're going to continue to work to make sure that nobody in Ulster County is hungry. The front page of the New York Times today had just an absolutely devastating coverage of hunger and food insecurity around the country, stories of children all around that are all around our country that aren't getting food. If you are out there or know someone who is struggling with that, we have many resources between Project Resilience and other community groups that are all part of this network of response. So no one should be in that position, and if you know someone or you are that person, please don't hesitate to reach out, and we are here for you on that. Finally, this was yesterday officially, but we didn't have a Facebook event yesterday. So I did want to take a second and specifically give a shout out, a much deserved shout out to our nurses. Yesterday was National Nurses Day around the country. You probably saw many posts and notes and calls and things like that. But I did want to take a second, even though it's a day late officially, to thank on behalf of the 180,000 residents of Ulster County. We want to thank all of our nurses that are doing just absolutely heroic work every day, their families that are supporting them. We appreciate it. And I know that you've been thanked and that words only go so far. So we're going to do everything we can on every front to thank you and recognize you. But this is just a small token of that. And finally, beyond our nurses, I want to thank everyone who are out there, all of our frontline workers. This list that is far from exhaustive, but these are some of those folks that I know that I thank every time, but every time I do, I just think of all the stories that I'm hearing and seeing of people putting their lives at risk to make sure that we are safe, and we owe them doing our part to keep them safe. And that means continuing, despite the nice weather, despite the fact that you're probably going a little bit kooky with being inside and having all these restrictions, that we need to stick with this. We see it in the data. If you look at this chart shows you the result of everybody's collective work to, as we said early on, to flatten the curve. And you can see this sharp peak. That is the result of all of you doing what I know is very difficult, but let's continue to hang in so that we can continue this downward trend. These are the trends. These are the lines that we want to see on these graphs, not the upward lines. It's really good to finally see that we have turned the corner, and I want to thank everybody who's played a part in that. Thank you all for watching. Thank you to Radio Kingston. Thank you to our interpreters, Diane and Roxanne. Thank you, Manuel, for translating to Spanish language. We're here for you, whatever you need. I won't see you again in this venue until Tuesday. So for those that I don't see or talk to, have a great weekend. Stay healthy and safe and resilient, and we will see you on Tuesday.